A coronavirus testing site in the middle of a race course. The city of Baltimore recently opened this testing location after data showed that this area of northwest Baltimore, where 95% of the population is black, had the highest number of COVID-19 patients in the city.
It was inevitable. It was going to come anyway to us. We get everything. It's getting harder. People getting prepared because people are going to be really broke, really stressed out, and when you're in them kind of neighborhoods, people start preying on the weak. The best that we can do is just keep the house clean and stay away from people, try to keep people away from us.
I have COPD, and I know it can infect me quicker, so I just stay in the house and do what I have to do in the house and get my son to do everything for me.
Are you afraid?
Yes, I'm very much afraid.
Data published by the Center for Disease Control shows African Americans are disproportionately affected by the coronavirus. Here in Maryland, black residents make up less than a third of the population but represent 37% of COVID-19 cases and 44% of deaths. For Dr. SLOCUM, the coronavirus is simply emphasizing pre-existing inequalities.
What COVID-19 does is it illustrates and exemplifies the disparities which already exist in our healthcare system already. So, as you can imagine, access to healthcare, pre-existing conditions are some of the things that are most prevalent in communities of color. So when something like this hits, of course, it's going to hit communities of color more rapidly, harder.
Underlying conditions like diabetes, obesity, or lung disease are more prevalent among African Americans, making them more vulnerable to the virus. But blacks are also overrepresented among frontline workers like bus drivers, nurses, or food workers. More exposed and more at risk, African Americans are also less likely to have the resources to face a pandemic.
Poor people are more vulnerable, and it's not because of biological structure or anything like that. It's because of all the underlying factors that don't get addressed because they're poor and don't have access to the resources, medical resources, etc., to respond to it. Health information, resource information, healthy eating, access to information is a major issue.
Keeping the community informed has fallen back on local figures who use any opportunity to remind people how to stay safe and take the virus seriously.
Stay 6 feet apart. Folks, I'm gonna tell you something. If you don't have a mask on, you need to start wearing a mask. This thing is no joke out here. Got a lot of people dying, a lot of people getting sick, and you heard the news lately. They're saying, especially with black men.
Baltimore community leaders are also worried about the economic impact of the outbreak in neighborhoods that are already struggling financially, a fear that is common to communities across the country.